cataracts come back. Some people who have had cataract surgery in the past report experiencing some cloudy vision that comes back. So what causes it, and can it be fixed? Dr. Richard Yem with Eye Surgeons Associates has some answers for us. Thanks for coming in.
Yeah, thank you.
All right, before we talk about the procedure to correct this problem, let's talk about what it is that's actually taking place. It's not really a second cataract, right?
That's exactly right. So what we're talking about today is called a posterior capsule opacification, or PCO. This is very common after cataract surgery. During cataract surgery, we actually remove the cloudy lens from inside the eye and replace it with a clear lens implant. But we leave the clear lens capsule behind inside the eye because that's what's going to hold the lens implant after surgery. But sometimes after surgery, that capsule will develop a cloud or film that grows over the back of the capsule right behind the implant. And that is what the PCO is.
And that's what they're experiencing, is maybe creating this cloudiness that they think the cataract has returned.
That's exactly right.
So how common is this?
It's extremely common. So about 1/3 of patients that undergo cataract surgery will eventually go on to develop a visually significant PCO. That accounts for about 1 million new cases of PCO in the U.S. every year.
Wow. Okay, so other than cloudiness, are there any other symptoms to indicate that you need to see your eye doctor?
Absolutely. The symptoms often will mimic a cataract. You know, when patients originally have the cataract, have some of the same symptoms that they'll have with the PCO. The most common one that we hear is glare from bright lights, especially oncoming headlights when driving at nighttime. You mentioned the general blurring, difficulty reading. Those are the most common things, and when patients start to experience that, that's when we recommend they come in to see us.
And they shouldn't be afraid to come in, because this procedure to correct it is pretty easy.
That's exactly right. So the procedure is called a YAG capsulotomy. It's performed with patients sitting upright at a microscope, similar to the microscopes we use in our routine eye exams in clinic. It takes about 2 minutes. It's completely painless, and patients typically notice an improvement in vision within a day or two.
Oh, wow. Are there any risks or side effects from the procedure?
Yeah, every procedure we do has some risk of complication, of course, but this one is a very, very low risk procedure. It's actually less invasive than the original cataract surgery. We're not making any incisions on the eye. We're not going into the eye with any instruments. And so there's no risk of infection. Patients don't have to use any eye drops afterward, no activity restrictions. So it's very, very well tolerated. I recommend for any patients who are having any of those symptoms, they're driving, their reading is being impacted, that we go ahead with the procedure.
Mm-hmm. Is there any kind of condition that might mimic this, this condition and be something else?
Yeah, I mean, a real common thing that I can think of would be dry eye. Just, you know, blurry vision, especially if it's fluctuating. Dry eye is one of the more common things. You know, just coming in for an eye exam, though, is very important. We always look at the front of the eye, into the back of the eye, at the retina, because blurry vision can come from a lot of different places. We want to make sure that there's not something underlying going on in addition to a PCO.
Yeah, well, this was very interesting. We appreciate you coming in, Dr. Richard Yem with Eye Surgeons Associates.
Thanks a lot.